Hi there, this is Dr. Maureen Sutter from Red Oak Animal Hospital, and we're continuing our talk on senior horses. And we're going to be talking today about the importance of dentistry. And with our older horses, it's important to do a yearly exam. I like to do a sedated oral exam so we can sedate the horses, put a full mouth speculum in, so we're able to do a full oral exam. And so I've got some pictures here of a horse we worked on in December. She's a 24-year-old thoroughbred mare. She has had regular dental care these past few years. And so I've got a picture here. I try to get pictures of all of our oral exams that we're doing so I have a comparison. So we've got some pictures of previous years to look at. So I normally get a good view of our incisors from the front and the sides, as well as I'd look back in her to see her cheek teeth, her premolars and her molars. And so here we can evaluate her teeth. We've got some feed packing kind of in between her teeth, but really no other abnormalities in here at the moment. When we get back and look in her mouth, so I normally take a view from each side so we can see the upper arcade and the lower arcade. And again, with her age being 24 this year, and horses' teeth continue to grow throughout their life, so they have X amount of teeth in there, and they continue to wear down yearly as they chew. And so she's got some teeth that are right in the middle there of her cheek teeth that are starting to wear down more, and so they get to what we're called cupping. So it's a little bit depressed in her upper teeth here. A lot of times then we have the lower teeth that kind of start growing up into that space as well. So that's something that we're looking at yearly and evaluating. Do we need to kind of level that out? In her case, she's got some area, some diastema, which is a space in between the teeth. And so we're concerned about that as far as periodontal disease, and horses can start to kind of pack some feed in and around their teeth. And it can kind of just keep working its way in there, and then basically end up with some gingivitis around the teeth, and then we end up with some periodontal pockets. She's got some area where the teeth have kind of spaced apart a little bit, and so then there's some feed that ends up in that space. She's got the same thing going on, the same teeth on the other side as well. So we've got some feed material that you can see up in there. So normally I'll get some pictures to start with, go in, do the full exam with a mouth mirror to be able to evaluate and get a closer look at all of those teeth. And then we'll go ahead and do the routine float, try to take care of any of those sharp points, try to level out what needs to, and then also take care of this feed material. We'll go in there with my pick and remove all of that, go in and lavage those areas, rinse them out, try to get them as clean as we can. We want them to be void of feed material and allow them some healing going forward, so we can end up with some more normal tissue in there. And when we do see them routinely, and we're able to take care of this on a fairly regular basis, you know, we're able to prevent any further issues going forward. The concern is if we end up with a whole lot of feed material in there, periodontal pocketing, that we can end up with an abscessed tooth, tooth root abscesses, and you know, maybe looking at a situation where we need to extract that tooth. So those are some of the main things that we're looking at in this mare's